Hi, this is Dr. Charlie Eastman, the Medical Director of the clinic at Number 1 Harley Street, Number 1 Health, www.number1health.co.uk. This is a very brief video about flu, and a colleague of mine will ask questions related to that. Do you want to fire off the first question?
Yeah, Charlie, can you tell me the difference between ordinary seasonal flu and swine flu?
Yeah, very interesting question. Ordinary seasonal flu occurs every single year. It's slightly different timings in both the northern and southern hemispheres. In our part of the world, usually we'd expect it to start around about late September, early October, and go through to somewhere like January to February. In other parts of the world, it might start around about April and go through to September. And there are some subtropical areas of the world where it's actually there all the time, and that's quite relevant for travellers. Now, ordinary flu is not a mild disease in the sense that it can cause severe fever, headache, muscle pain, and it can be very unpleasant. And ordinary seasonal flu kills in the UK anything between 3,000 and 12,000 people a year. Now, most of those people who die are vulnerable people with existing heart, lung disease, or might be elderly. And one way to look at it, it's almost like the last puff in a sail of wind that pushes their boat off the edge of a sort of waterfall or something like that. So that's the ordinary seasonal flu that occurs every year without fail, and there's no scientific reason to think that it will never ever stop. The difference with a pandemic flu is they occur in a different cycle, so they don't occur every year, but they might occur every 33 years or so, or to put it another way, in 100-year episodes, then you'd expect at least 3. And that's been going on since we've been recording these things for at least 400 years, and there are histories that indicate it happened before. So in recent history, there was 1918, which was the worst one that we know of, which had a mortality among those affected of about 3%, and that's estimated to have killed more people than the First World War itself. Then we've had 1957 and 1968. They cost the economy billions of pounds, but had a death rate much, much lower than 1918, around about 0.3%. Now currently we have a pandemic of a virus that some people have called swine flu. WHO now prefers to call it H1N1. In the UK, this started around about April of this year. One way to look at it is that we've now had the first wave of that's affected certain schools, certain people. Under 100 people, I believe at the last count, died from that. And the question is, what's the next wave of it? There'll be another wave, probably in the next few weeks or months, and possibly a second. So we're not out of it for at least another 6 months. And it may be a very mild disease, that seems to have been the pattern so far, or we may be unlucky and it may change.
And can you tell me what's the difference between common cold and ordinary seasonal flu?
Yeah, the best way I think to look at the common cold is almost like the difference between a cat and a tiger. The common cold you could regard as sort of like a cat. It's a mild disease, not the high fever, not the muscle ache, not the headache, and you're not incapacitated. You might have a runny nose, but you can do normal activities. If you get a flu illness, completely different. You're so tired and affected that even if I dropped a £50 note, you wouldn't want to pick up to get it, and you'd probably want to stay in your bed all day.
What can we do to protect ourselves?
Yeah, again, a very good question. The flu viruses, we know, are transmitted in the air, and they do hang out on door handles, keyboards and things like that. So the important thing is, if you've got a cleaning company, make sure that they regularly, maybe every 4 hours, clean door handles, clean cupboards and cupboard handles, and also keyboards. And also that we would introduce some degree of social distancing. So in France, for example, they kiss each other on the cheek, they'd stop doing that. We might stop shaking hands, and those sort of things are basic things. Now, there's no definite scientific evidence as to whether masks will be helpful, but some people, as you know, prefer to wear the mask. The other thing is that we've got these antivirals, one of them is Tamiflu and the other is Relenza. The government have stocked up, some private companies have stocked up. They have some beneficial effect in terms of reducing the amount of period that someone is ill, and also the shedding of the virus from that person, so they can help reduce the person's illness. And then finally, we do have a vaccination for seasonal flu that varies each year. It's not always highly effective, but in some years it's more effective than others. And they've now developed a vaccine for H1N1, which the UK government will make available to everybody in the UK. That's my understanding.
And in relation to vaccination, what is the difference between the ordinary flu vaccine, which we see every year, and the swine flu vaccine?
Yeah, what happens is the ordinary flu vaccine is tracked by the World Health Organization and has three components, usually an A and a two B components. So WHO says to the manufacturers, make a vaccine with these components, and in any one year that vaccine may be very effective, in another year it may be less effective, because there are always more flu vaccines circulating than the ones in the actual vaccine. However, swine flu vaccine, or H1N1, is a very specific vaccine that the manufacturers have made to combat the pandemic that we've talked about that occurs in these cycles of every 33 years or so. So some people actually will require both two different vaccines.
And what about our children?
Yeah, children is a very good point. In America, they're very keen now to ensure that children get vaccinated against ordinary flu, because what they've worked out is that children often are the ones who bring the flu to adults, because anyone who's been in the school knows it's sort of almost like a breeding ground of infection. So flu vaccines can be made available for children. From 3 years on, a child would get the same dose as an adult. From 6 months to 35 months, they get half the adult dose, and if it's the very first time they've ever had a flu vaccine, they have a second half dose 4 weeks later. So that's how it should be done. And certainly in America, children at school age do now get the ordinary seasonal flu vaccine.
What advice can you give for pregnant women?
Very good question again. We know that pregnant women are vulnerable both to ordinary flu and also to the swine flu, or H1N1. So the UK government now has introduced a policy to recommend that pregnant women go into the vulnerable group who are offered ordinary flu vaccination. And the doctor needs to make a risk assessment in the situation as to whether the woman would also benefit from the new swine flu H1N1 vaccination.
And what about travellers?
Yeah, I think it's a good idea for our travellers to have flu vaccine, ordinary flu vaccine, when it's available. That is usually about the end of September to January, especially if they're going to tropical regions or the subtropics, because as I said before, those are parts of the world where flu is there all the time. I'm also a keen advocate on business travellers having access to antivirals that they can take with them, because you may end up in a country which is suffering from an outbreak of either ordinary flu or pandemic flu, H1N1, but that doesn't have any Tamiflu. So I believe it's within the duty of care of your employer to make sure you've got the antivirals so that you can use them in the country that you end up in.
So in summary, what is your main points of advice?
Yeah, thank you very much. My main points of advice is treat flu as a serious problem. If you're a company, make sure you have policies in place as to how to deal with it. Remember that seasonal flu vaccination can make sense to your company to ensure that the staff are protected and as much as possible. And the government will try to ensure that everybody gets access to the pandemic or H1N1 vaccine when it is available. Also, as a company, if you're not confident that the government has sufficient stocks, you may want to get access to Tamiflu for your staff, or especially your staff who are travelling.